We are demonstrating how to give oxygen to a patient in an oxygen cage. This is Pepe, our patient. We have multiple pieces, but not too many for this setup. We have the cup full of water. We have the lid and attachment that will go onto the water that's connected to a tube. This tube needs to have this piece on it. You will have this little 3 kind of stopcock piece, and then these oxygen adapters, of which we typically use the green one, which is 40%. Now this one actually is 60%. We typically want 40%, which is actually the red one. So what we do is we place the patient in the oxygen cage. We close up the oxygen cage. We are going to screw the lid on top. Okay, this piece will actually screw on to this oxygen tank here. I'm just gonna screw that on. We need to turn the oxygen on by turning this to the left or counterclockwise. This arrow should come off of 0. And then turn this counterclockwise to turn on the oxygen. If it is on, the water should bubble. If the water is not bubbling, you have a problem. So then I'm going to attach this white piece to the bottom of this blue piece, and then my oxygen choice onto the end. And then this blue piece will then go into the oxygen cage. Oxygen will flow through the tube into the cage to the patient. The water will keep the oxygen humidified so that they don't dry out their nose and their lungs. And the other thing which is often helpful is to put ice packs inside the cage with the patient, because as they're panting, they're heating up their oxygen cage and you want to keep them cool.
Dr. Simons, how come I wouldn't use this machine? Is it okay if I take this tube here and put it directly into my oxygen chamber?
This would not be ideal because A, this is not humidified oxygen. It would be straight oxygen. And we are using the humidified oxygen from this tank to the cage.
Okay. Do I have to touch anything over here to make sure that my oxygen's on?
We are not touching this system at all. Oxygen cage use is only to this tank and to this oxygen piece.
Cool. Okay, so what about this? Do I need to put anything special in here?
In here is simply water. It doesn't need to be distilled or sterile water. It's just regular tap water. And we cannot put any additives in here.
Okay.
You're just gonna turn this knob clockwise gently until the ball is to the bottom. You don't wanna over tighten it, that'll break it. And then you wanna turn this main oxygen tank clockwise to turn it off.
Okay. How would I disconnect the bottle from the
So in
actual
order to
oxygen?
disconnect this, you're gonna turn this clockwise, just this white piece, and that's gonna disconnect.
Okay, and that's it?
And that's it.
All right, cool.